Hello, everyone, and welcome back to RN Info, the place where you get clear, reliable information on health topics. Have you ever been out walking and suddenly felt this pain in your legs that goes away once you stop and rest? That could actually be a symptom of peripheral artery disease, and that is exactly what we're talking about today. Peripheral artery disease, or PAD for short, affects more than 200 million people worldwide, with Black people being at a higher risk. So, today we're going to unpack what PAD is, how it develops, the symptoms, the risk factors, diagnosis, and treatment. And as usual, there'll be questions at the end to test how much you've retained. So stay tuned. Let's dive right in. What is PAD? Peripheral artery disease is a vascular condition that affects the arteries of the arms, legs, and pelvic area. These arteries become narrowed or blocked, usually due to plaque buildup, which limits blood flow. The lower limbs are more commonly affected than the upper limbs. Now, moving on to the mechanism of PAD. The most common cause of PAD is atherosclerosis, the gradual accumulation of plaque inside the artery walls. Here's how it unfolds. First, plaque builds up gradually inside those arteries. Then, a piece of that plaque may break off, causing a blood clot to form. That clot further narrows the artery or even blocks it completely, preventing the surrounding tissues from receiving blood, oxygen, and nutrients they need. Essentially, the cells are being starved. So, moving on to symptoms. Most often, the first symptom of PAD is that leg pain we mentioned at the start. Pain that occurs during physical activity like going for a brisk walk. This is called claudication, and it happens because the narrowed arteries can no longer meet the muscles' demand for blood. As PAD progresses, that leg pain may also appear at rest. Other symptoms of PAD may include slow healing ulcers, slow growing toenails, little, slow, or absent hair growth on the legs, changes in skin color, the skin may appear pale and shiny, and changes in skin temperature, cool to touch, along with numbness and tingling. When you look at these symptoms, you will notice a pattern. Most of them arise because these tissues are being starved of blood, oxygen, and nutrients due to those narrowed or blocked arteries. Okay, let's move on to risk factors. The major risk factors include smoking, which damages the lining of the blood vessels and increases the risk of plaque buildup. We also have diabetes, high blood pressure, and high cholesterol levels. For complications, some complications that may arise from PAD include critical limb ischemia. This is where tissues begin to die due to severely reduced blood flow. Wounds and sores fail to heal, and amputation of the affected limb may become necessary. Another complication may include stroke and heart attack, and this just happens when plaque builds up in the blood vessels supplying the heart and the brain. For diagnosis and treatment, several tests may be used to diagnose PAD. The first is a physical examination, an initial clinical assessment where the provider asks about your overall health and focuses on your symptoms. Another test is the ankle brachial index, or ABI, which compares blood pressure in the arm versus the ankle. There is also vascular ultrasound, which measures the speed of blood flow through the arteries, and a CT angiogram, which identifies narrowed or blocked vessels. When it comes to treatment, pharmacological options include blood thinners, which reduce the risk of blood clots, vasodilators, which help the arteries open up and improve blood flow, and statins to lower cholesterol, alongside other medications that help manage high blood pressure and diabetes. Non-pharmacological management focuses on lifestyle changes like quitting smoking, which is essential, following a heart healthy diet, and incorporating regular exercise. If other treatments are no longer effective and PAD continues to worsen, the following procedures or surgeries may be considered. First, angioplasty. This is where the doctors open up space within the artery to improve blood flow. A stent may also be placed to keep it open. And then there is atherectomy, which removes plaque using a thin specialized tube. And we have peripheral artery bypass surgery, which creates a new route for blood to flow around the blocked section of the artery. Alright, we've reached the end of the main content, and now it's time for questions to see how much you've retained. Question 1. What is the primary physiological cause of peripheral artery disease? The answer is the gradual accumulation of plaque inside the artery walls. Question 2. In the context of PAD, why might a patient experience pale, shiny skin and slow-growing toenails in the lower limbs? The answer is the tissues are being starved of blood, oxygen, and nutrients. Question 3. Which symptom is uniquely characterized by leg pain that occurs during physical exertion but typically subsides with rest? The answer is claudication. And that's a wrap. If you found this helpful, please like and subscribe. Let me know in the comments how many questions you got right, and I will see you in the next one. Thank you.